Okay, respiratory emergencies. Introduction. Respiratory distress is a disorder of normal oxidation process. The body cells due to damage to the respiratory system. A significant percentage of patients die from breathing complications every year. Patients suffering from respiratory emergencies need very high priority. The clinician must quickly identify the medical condition, identify the cause, begin treatment, and transport to the hospital as soon as possible. Clinician and these like us need to. That's the word. Diseases and conditions that cause respiratory stress. Asthma. We all familiar with asthma. Chronic obstructive pulmonary disease, COPD. Pneumonia. I always said Hebrew once and then English once, and then Google Translate English twice. Hyperventilation, not overventilation. Pulmonary embolism, we have a blood clot in the lung. Pulmonary edema, we spoke about that, where the swelling causes drowning in the lungs. Anaphylaxis is severe allergy, which we, at least Americans, peanut allergies, bee stings, and other people are allergic to fish, milk, and all these good stuff. Trauma, someone gets stabbed in the lung or gets injured in the lung, that can definitely cause breathing issues. And cancer, we have cancer in the lungs, it can cause severe breathing issues. General signs. Complaint of respiratory distress. If you believe them, then that's a sign of respiratory distress. Patient's position, sitting, leaning forward in tripod position like this fellow. That is a position that we naturally get into when we're having a hard time breathing. It's to help us inflate our lungs breathe. And we know somehow humans know how to get to that position when they want to take big breaths. Tachypnea. Who knows what tachypnea is other than Renee? Other than Renee and Joshua? Yeah. Tachypnea. Very good. 10 points. Somebody write it down.
Just do it when I'm older.
So
Add
fast.
10 points to it. She asked you to add 10 points to see if you have.
Still not enough. Tachypnea. Tachypnea. Fast breathing. Tachycardia. Fast cardiac. Fast pulse. Peripheral or central cyanosis. Cyanosis. Google translated bluish discoloration. I'm not sure what the word is. Bluish discoloration. No, it's using auxiliary muscles. You see them using the ribs and other muscles that someone who wasn't strong to be able to use. And strange breathing sounds. Like we said, if you hear the hookah, pulmonary edema. You're squeaking, asthma, croup. Different sounds for different patients. Acute respiratory distress, inability to complete a sentence. These are symptoms. Inability to complete a sentence using auxiliary muscles. Tell them, can you please count to 10 for me? And you want to see at which number they need to take a breath. So someone healthy can say 1, 2, 3, 4, 5, 6, 7. Like, they should be able to count to 6 before they take a breath. 7. If they say 1, 2, that they can't complete a sentence. Changes in consciousness, restlessness, anxiety, sleepiness, again, we said this is like when it's actually like suffocating. So then they start becoming anxious. I mean, some people start to panic because they're imagining they're having a hard time breathing. That's enough. So I'm not talking about every patient. Peripheral or central cyanosis, cold sweat. Cold sweat is because of the adrenaline secretion, because your body is kicking in, it's fight or flight survival systems. Asthma, chronic disease of the lower respiratory tract, very common. 5 to 7%. I don't know why 5 to 7, like 6% of adults. What does that mean? 5 to 7% of adults. Anyone has an explanation? 6% of adults, 10% of youth. Most common among young children and adults. What other ages are there? I'm not sure. About
Sad to know that about 5,000 people die in
yeah,
the
maybe
United States.
a mistranslation of children and young adults. About 4,000 to 5,000 people die from asthma in the United States every year. Okay, there is 330 million people there, but it's still a high rate of fatalities considering 4,000 to 5,000 is a lot because we're not. The United States is not a third world country. I mean, people may argue, but
That's in the third world country.
but they have a pre-established medical system. So 5,000 people die in the United States a year from asthma. That's pretty serious. The process recedes spontaneously or following treatment. The process. So the symptoms disappear spontaneously or following treatment. Asthma is characterized by an airway reaction. So our airways are tubes that lead into the lungs, and they're in the lungs. So start getting narrowed. You see here is a healthy trachea, and here is a spasm, mucus, full trachea. It's not easy to breathe through that, so it's very hard. People die from asthma. The mechanism that kills them is that they get too tired. It's just too hard, too difficult. You're trying to exhale air through a straw. Right? We can do a bet here how long Joshua can breathe out through a straw. I don't know how long it'll last. 5 minutes, 10 minutes. At some point he's gonna pass out. It's too hard. You just get too tired. I found a patient once lying on the floor, and her friend said that she was having an asthma attack for too long. She would have been in the tripod position when she collapsed onto the floor. She was 2 weeks left. So I'll explain what we did later when we go through the treatment. But it's very tiring, it's very hard. What we would have to do is we would have to connect the ambo pump to that straw and help him breathe. Besides for the advanced treatment that the intensive care unit can give. At our level, we can't give these medications unless it's prescribed by the doctor. In which case, we could call medical and ask if we can give the dose that is prescribed by the doctor, and then we can give it. But if he didn't have medication and he's getting tired, we would vet with them, but we'll speak about that in a few minutes.
Can I ask you protocol? If the patient is a known asthmatic and they've got like an asthma attack plan in place, are you allowed to follow that?
That's what I meant. His asthma plan is medication, right?
So if they have a bronchial dilator, inhaler, whatever you call it,
Inhaler.
then you can say,
Yeah, go ahead, take the
you
puff.
give it, can you?
I'm
give
talking
it
about
to
more
them?
advanced medications.
Ah,
The puffer, go ahead. Just because I'm here, I'm not going to stop you.
but it's not on the ambulance, right?
No, we don't carry it in our ambulance. Intensive care have those stuff. We don't carry any of these breathing medications in our ambulances. In America, they carry like Benadryl and stuff for croup, and maybe also for asthma, but in Israel we don't. We just send an intensive care unit. They're not always available. And you try to get a paramedic or doctor who's a volunteer. Some of them on motorcycles and some of them by car. They can come and give these medications because they have them in their pool.
That's interesting that like some things you carry and some things you're not allowed to carry.
Right, it's all, you know, it's, they, when they make these